Hey guys, welcome to the next video. This video is going to be about therapy, and with the therapy topic there's going to be two videos. So this is part one. The second video will be therapy part two. What are we going to look at in this unit? Well, first of all, we want to remember what causes psychological disorders, because with therapy we're going to be trying to fix those. So I want to remind everybody what the biopsychosocial model is. The biopsychosocial model is the idea that there are biological factors, social factors, and psychological factors that contribute to a disorder. So therapy should be addressing all of those domains. We have a bunch of different types of therapies we're going to look at: psychoanalysis, humanistic, etc. We will be talking about all of those today and in part two. Quick history. People with psychological disorders were really mistreated in the past. They're subjected to strange, debilitating, downright dangerous treatments, locked up, locked away. So there's a bad situation centuries ago. Two people helped change that. Philippe Pinel and Dorothea Dix really started pushing for the humane treatment of the mentally ill. Therapies. What do we mean by therapy? First of all, the word psychotherapy is a word for all types of therapies involving emotionally charged, confiding interaction between a trained therapist and a mental patient. So that's not all treatments of disorders, but all the therapies together are called psychotherapies. Now, there's going to be quite a few kinds. They're quite different depending on the perspective. There's the Freudian perspective, the behavioral perspective, for instance. In contrast with psychotherapy, there's something called biomedical therapy, which is using drugs or medication to help people. There's also something called the eclectic approach. Eclectic means that you're borrowing lots of ideas from different sources. So a lot of therapists today would consider themselves to be eclectic. They're borrowing the best ideas from all the different therapists that have come and gone. Okay, the first one we're going to look at is psychoanalysis. This was Freud's type of therapy, and there's going to be some confusing words. So psychoanalysis is what Freud did. Psychotherapy was all the types of therapy where whenever you're sitting down and talking to a person. And there's going to be another confusing word called psychodynamic, which is like the modern version of Freud. But Freud's was called psychoanalysis. So what was it? Its aims. Since psychological problems originate from childhood repressed impulses and conflicts, the aim of psychoanalysis is to bring repressed feelings into conscious awareness where the patient can deal with them. So their assumption is that psychological problems are in the unconscious mind, and we have to bring that out to conscious awareness. The methods. Freud used a method called free association. He started by using hypnosis and analyzing dreams, but free association was his type of therapy, where the client would lay down on the couch, facing away from the therapist, talk to the therapist, and the free association was just saying whatever came to your mind without editing it. During free association, people tend to edit anyway. And so that would be called resistance. Resistance to letting sexual or aggressive urges be expressed, or conflict-driven anxiety is what he called it sometimes. Patient also might engage in something called transference. Transference is when you take negative or positive feelings, maybe towards your parents or your friends, and you transfer them onto the therapist. So you might start hating the therapist if you hated your dad, or you might start loving the therapist if she reminded you of your mom. So there were some criticisms of psychoanalysis. One is that it was hard to refute because it cannot be proven or disproven. Since their assumption was that there's something in the unconscious mind, you can never prove or do research to find out if something is in the unconscious mind or not because it's unconscious. The person doesn't know about it. So you can't research to prove the effectiveness of psychoanalysis. Also, psychoanalysis, you would meet multiple times per week for at least an hour, and you're paying a lot of money for that. So some people thought maybe you weren't getting your money's worth. Okay, so here's the other tricky word. So I said psychotherapy was all the therapies. Psychoanalysis was Freud. Psychodynamic is kind of this modern version of Freud without some of the weird Freudian stuff like the Oedipus complex or penis envy or all the different stages, anal and oral stage. So you sit face to face, and the therapist is trying to understand the symptoms and helping the patient out. Still, there's some emphasis on the unconscious mind with psychodynamic therapy. Okay, now we're going to move to another perspective called the humanistic perspective. These therapists aim to boost self-fulfillment by helping people grow in self-awareness and self-acceptance. So this is about growth. As opposed to Freud's emphasis on darker, unconscious, aggressive, and sexual forces. This is about taking where you are and trying to boost you and help you realize your dreams in life. One technique was called active listening. This is when the therapist would restate and clarify the patient's thinking, acknowledging their emotions that they express. A lot of therapists today would do active listening. There's also something developed by Carl Rogers called client-centered therapy. In this type of therapy, therapists listen to the needs of the patient in an accepting and non-judgmental way. You address problems in a productive way, building self-esteem. So you're focusing on the client and what the client needs and how to help the client. You're not so much trying to make the client fit into your theoretical framework like Freud was doing. Okay, with all these therapies we're talking about, we have to remember that the therapist needs to have certain ethical standards. The therapist needs to maintain confidentiality. That means they can't tell other people about what's going on in your therapy session. They can't even tell other people that they're seeing you. The therapist cannot have multiple relationships, so they can't be your therapist and your brother-in-law and your barber or whoever. You can just be the therapist and that's it. Also, obviously no harming or exploiting the client. So if the client is a stockbroker, the therapist cannot be asking him for stock tips and trying to get inside information. Okay, finally, this is the end of part one. What about effectiveness of therapy? This graph shows the effectiveness. The blue line is an untreated person on average, and the orange line is a treated person. And to the left is a poor outcome, to the right is a good outcome. So when they survey people who have been in therapy compared to who haven't been in therapy, there's a much higher rate of people who've been in therapy. It says 80% are treated better, 80% better. So therapy is hugely effective, and we're going to talk about a couple more types. We're not done on part 2 of the video.